to Madhuviti Vlogs. I'm Asha Sri Raja Madhuviti. I'm emergency medicine physician in UK. Thanks for watching my videos. If you like my videos, please don't forget to like, share, comment and subscribe. If you subscribe, you'll get the notifications as soon as I do my new video. So now the time is 6 a.m. in the morning. I'm on night shift. I just came for my break. I had a thought that to do a video on ED doctors and their break times. So I just want to share what we will do on our breaks and how much break time actually we get in a shift. If you are interested in knowing about how much time we get as a break in our shift and what exactly we do with our breaks, please stay tuned. Continue watching this video. I'm going to explain in briefly what exactly is our break time and what we do. Coming to today's topic, break time. So for a 9-hour shift, we have approximately 30 minutes of break time. And if we do more than 9 hours, we can have 2 30-minute break, 2 30 minutes as a break time. Like we get overall 1 hour as a break time. If we are doing more than 10 hours, like for suppose 12 hours, then we get 3 30 minutes as a break time. So usually on a 9-hour shift, the 30 minutes is just for having food. We just get refreshed, go to the staff room, have some tea or toast, or if we bring a food with us, we'll just have a food. Or sometimes we just need to go to canteen and fetch some food. The 30 minutes just finishes in a minute, kind of. Like it doesn't feel like that we had a break at all. So it will be just over within a fraction of time, like kind of. However, in night shifts we get a little more time extra, especially when we are doing a 10 hours or 12 hours shift. But some days it is not possible to take break at all, because if we are in a critical area of the emergency department and we are seeing a very sick patient, then we cannot take a timely break. It will be delayed. Sometimes we don't get to go to break until very late in our shift. For example, today I'm on night shift. I'm doing a 12-hour shift. I started my shift at 8 o'clock in the night, but until 4 o'clock in the morning I did not get to go and have some tea. That was only for 10 minutes. As I was on my break, I was alerted that there was a sick patient in the recess, so I need to attend that patient. So I have to skip my break and go and attend that patient, because in the nights I will be the in charge on the shop floor, and as a senior person I have a responsibility to make sure that all the sick patients are seen by a senior person and proper decision making is done. So I have to get back onto the shop floor and make sure this patient is safe and treated properly. Once I treated that patient, then I had another challenge of dealing with a patient who was handed over by the previous team who finished their shift. So in sorting that patient, I spent nearly more than 3 hours. So my break is gone in air. Until 6 o'clock I did not get time to get refresh myself. Well, it's not so good to not have a break and work at an hour shift. It is not recommended, because if you don't have a proper break, your thinking will be clouded. You cannot make proper decisions, and it is a risk for patient safety. They advise a break is needed after every 4 hours of shift to make yourself, your mind clear and yourself refreshed, and to make you more energetic by pumping some glucose into the body. but it will be not possible all the time. Sometimes the shift just ends without having a break. Now the BMA and GMC had a strict rule that if you have not taken a break, and if you compromise the care of the patient, and if you are questioned or called to a question, then you are responsible for that. So in that way, it is ensuring that doctors take breaks so that they don't compromise their thinking, and they stay more alert and more focused on their shifts. um, After all this, the day shift is different from a night shift. Night shift, your thinking will be clouded and you will be less vigilant, less more proactive compared to the day shift. Most of the times, our break times just for having food or refreshing with a drink. It will never be like sitting down and enjoy the break. It is not a luxury, it is just like looking after ourselves. So my suggestion for the ED doctors all over the world is, please ensure take your breaks. Don't neglect your breaks because they are very important for our good decision making and good ED practice. So we need to make sure that we have a proper break. I'm also trying to ensure that I take my breaks at regular intervals. When I'm on show floor, I ensure my juniors have breaks on proper times. However, sometimes I miss my breaks. That is only on night shifts and occasionally, not on a regular basis. So otherwise, I'll make sure that I had a proper break. So you take your breaks, you enjoy your breaks, make sure you look after yourself and enjoy your life. Take care. We'll come again with some more interesting information and some more interesting updates about emergency medicine. Until then, keep watching my videos. Please don't forget to like, share, subscribe. Thank you, everyone. See you again. Bye bye.